Good afternoon, I'm Robert. We're at Table 4. We're the hydrogels for the WCEI hands-on training class. Today I'm going to talk a little bit about hydrogels, and as you guys have learned through your entire life as being a caretaker and what you're learning here at the WCEI hands-on classes and lecture, that hydrogels are developed to promote moisture to the wound bed. Right. What does moisture do for that? Helps with pain control, allows cells to migrate easier, helps speed up the wound healing process. Back in the 60s, they showed that moist wound healing is the #1 avenue to a complete closure in wound care. So what we're going to talk about are water-based hydrogels, glycerin hydrogels, and polymer hydrogels. Your water-based hydrogels are primarily, like they say, water, 96% water, with a small percentage of a polymer to help keep its viscosity, its thickness, and to help it keep its moisture content. We're in the winter time here in Kansas City, and as you know, fireplaces and furnaces are going. It helps evaporate the moisture out of the room and out of the people. Same thing if you're in the desert or someplace like Nevada. Might need to check your dressings more frequently when they're water-based than those that are made out of other products, because they can evaporate and become hard, crunchy rocks in your wound bed, and you don't want that to happen. Because they're made out of water and they're hydrogels, they all have the HCPCS codes for daily dressing changes. That way the moisture content level can stay where it needs to be in the wound bed. Now the amorphous hydrogel usually comes in all sizes of tubes and spray bottles and different sorts of sachets for applicators. You can find it in many different forms. And again, it's mostly like thick water is what it is. This product is used on superficial wounds all the way through stage 4 wounds, but it is not recommended to fill an entire deep cavity with amorphous hydrogel. That's more like putting a cup of water into the wound bed. It gets filled with all its bacteria, it's nice and warm, and you end up with a prone for infection. So hydrogel amorphous are just to coat the wound bed itself and keep the moisture level there. It's not to fill a huge cavity. If you have that big deficit in the cavity, they take the same product, the amorphous hydrogel, and they impregnate gauze and ropes and sponges and foams and different things like that to help take up some of that dead space area. But it's still, the percentage of hydrogel is mixed in with the other article to fill that dead space in your wound bed cavity. Now if you're using this as a packing material, #1, you want to pack it nice and lightly so that you don't stop and put too much pressure on there and cause granulation tissue to stop filling in the wound bed. You want that granulation tissue to continue to fill. So if it's too tight, it's going to stop, your wound's going to heal, but you're going to have a deficit in your body makeup, in your skin design there. Also, if you're packing it with a whole wad of gauze and it's in a coccyx area, for example, and you're sitting on it, this extra product will cause that extra pressure on your wound bed, which could also deter wound healing. So impregnated gauzes, again, amorphous gel with impregnated, that helps fill the dead space. If you're on an area where it's more of a superficial wound or maybe a stage 2 type of a wound, they have a water-based hydrogel sheet. If you're going to cut the sheet, you want to leave all the plastic on it when you take it out of its envelope, and you want to cut it. You don't want the sheet dressing, because it's made out of water, to overlap the wound bed and cover the peri-wound skin. You can have signs of maceration if you keep water on skin too long, so you want to make sure that it fits the wound bed. Otherwise, if you want to use it as an occlusive dressing, you pull the thinner slice of plastic mylar off, and you would just lay this right down in there. Again, you want it to be the size of the wound. You don't want a whole lot of overlapping for maceration purposes. You'd lay that down with the blue plastic on top of it, and then do your window pane border with tape, whatever works best for your skin integrity of your patient. Another option is you can also take it and you can remove the blue backing off of the gel, and again, you want it to fit the wound, but you can use this as a filler too by folding it or cutting it ahead of time and laying this down into the wound bed. All these products need to be washed out of the wound bed. Again, daily is acceptable and billable, but we a lot of times like to say check it every 2 days and let the wound bed kind of take its time in its healing process. Okay, so you have amorphous gel, impregnated gauzes and foams and products of that sort, and you have water-based sheet dressings. Another type of hydrogel is the glycerin-based hydrogel sheets. There's just a couple of them in the marketplace, but they're a little bit unique to the water-based one. Number one, they will never dry out, so you don't have to worry about that problem with them getting dried out and turning into a hard rock in the bottom of your wound bed. And they'll also be comfortable. They'll mold to the body and move with the body, so they'll be comfortable. They also have the capability of not only giving moisture to the wound bed, about 10% of its content, but it can also absorb up to about 4 times its moisture content, which in a 4x4 case is about what 2 calcium alginate ropes would absorb. So light to moderate amounts of drainage, you could still get away with a glycerin dressing. It also makes a perfect padding from shear, friction, and blunt force trauma. Scratching in the pickers, a lot of dementia people pick, so it gives you protection that way. It'll warm to body temperature and help maintain that wound bed body temperature. And it's also bacterial static and fungistatic, so you have infection control with this product. You can also cut the glycerin dressings by also keeping the mylar on it, cut it to the size that you need, but because it is glycerin, you really don't need it to fit perfect in the wound bed. It can actually overlay on the peri-wound skin and help heal that area also. Alright? Difference in glycerin and water. Come in all different sizes and shapes, as all these products do. And then your fifth type of a product here is a polymer hydrogel. As you heard me say, these are all made out of water and polymer, glycerin and a polymer. Well, this is the polymer itself. It comes in a 3-gram packet, and the directions for use say mix 3 grams with 30 milliliters of moisture, which I have done here. I use just some tap water, but sterile water or saline both work very effectively. So 3 grams turns into 30 cc's of a nice, moist, light powdered wound hydrogel, hydrogel wound filler, pardon me. As you'll see, it's nice and light and fluffy. It's not going to add that extra pressure as what an impregnated product might end up being. Simple saline rinses it right out of the wound bed. It is nice and moist when you put it in, but it also has the capability of absorbing up to 100 times its moisture content. So 3 grams could actually absorb over 300 milliliters of moisture. So if you do have moderate or mild amounts of exudate starting to happen in the wound bed, this will help absorb that and keep that perfect moisture balance. It'll also help you with your infection control by absorbing that extra moisture and bacteria, and you end up with infection control. So we have water-based amorphous gels, impregnated gauzes and products, water-based sheets, glycerin-based sheets, and polymer-based products. Okay, the polymer product, simple saline rinses it right out of the wound bed. If you don't get all the product out, normally when your wound's closing, it forces the extra product out, but you may see some of these granules. Those granules, over 30 years being used in the marketplace, have shown if they do get left in the body, that the body just encapsulates them and they become part of the scar tissue. It is not like leaving a foreign body like a gauze or a piece of plastic behind. Alright? So it is a safe product if you don't get all the product out of it. What I have for you for a handout, a nurse put together for us, and it just kind of gives you some of the features and benefits of a hydrogel and some extra breakdown on it. And then on the back side of it, you'll see where they have shown where a water-based hydrogel might be used over a glycerin or a glycerin over a water-based. And this is a very nice handout for you guys, just to keep the record straight of where you might and might not use a hydrogel. So hydrogels, moist wound healing, been around since the 60s, and I appreciate your time.